Well, hello, everyone. I'm Cheryl Dalton-Norman with Industry Insights with Cheryl. And I'm very excited today to have Stevie Bander from CBRE with me. And Stevie is the Managing Director for Healthcare Consulting for CBRE. And I'm super excited to talk about healthcare real estate today. In the past, we've talked about human resources, we've talked about IT, we've talked about AI, we've talked about revenue cycle. But the criticality of the facilities in which we care for people is really, really important. And I think a lot of healthcare executives can benefit from understanding much more about why that's so important. So,
Sure.
Stevie, would love for you to maybe introduce yourself, tell us a little bit about you, and then a little bit about what you do with CBRE and why real estate is so important to healthcare and to leaders making good decisions in healthcare.
Perfect. Thank you, Cheryl. Really appreciate being here this morning. So again, Stevie Bander, I lead our healthcare consulting practice here at CBRE. And so within our practice, we focus really on three main elements of delivery of service. One would be portfolio strategy. So looking at your facilities, both in the ambulatory and in the acute environment, to make sure that they adhere to brand standards, they are being heavily utilized based on the capacity within those physical structures. And then also making sure that you are in the right locations from a market sustainability perspective. And so that's been a really hot topic these last few months around really the trends within real estate and making sure we're maximizing our portfolio. The second area that we focus on is transition and activation. It's actually how I got my career started, helping hospitals move from point A to point B or merging two facilities into a new facility. And so we have a large team that focuses on ensuring the operations are ready, your nurses, your physicians, your staff are ready to operate in that new building. The physical environment is ready to operate for that first patient day. And it takes about 2.5 to 3 years to get that facility ready to actually go live. And then last, but certainly not least, is really our focus on management consulting. So optimizing spaces, not necessarily a new space, but making sure we're getting the most out of our operations within the acute care setting, infusion centers, things like that, looking at throughput, patient volume, and making sure, again, that we're maximizing the capacity within that real estate. So those are the really three major components that we offer here within our consulting practice. And again, thank you for letting me speak about it today.
Yeah. Well, two things really struck me is what the old real estate adage of location, location, location. But
Yes.
in healthcare, that's obviously important. But then the whole activation of 3 years. And if you think about how long it takes to construct something
Mhm.
and to be ready, you have to consider a lot before you even break ground
Yes.
and thinking about how you optimize those spaces. And when you all are planning, when do you all become engaged, I guess I would
Sure.
say, in the process with an organization who's saying, hey, we're shutting down this location, it's old, it's not working, and we need a new one. So at what point are you all engaged?
Sure. So typically we see the whole process from bond funding or some sort of capital funding to go live is roughly 6 years. So if you think about how long that takes to actually have an idea that comes to life, it's a very long runway. And so we typically come in after the design process is mostly complete. They've started to break ground and construction is coming out of the ground. Usually, most clients will go to RFP looking for a transition activation consultant. So while it's a very niche market, there's definitely some great competitors out there that we've have. I've worked for a few of them as well. And so we really look at within that 2.5 to 3 year window, we have some very key elements that we're focusing on. And ultimately, it's around change management, right? So if you think about your typical healthcare employee, a lot of our nurses, technicians, have been in that position within that health system for 20, 30, 40 years. So now we're asking them to change where they park, where they eat lunch, how they deliver care, what equipment they're using, their adjacencies, whether it's the lab or the pharmacy. And so all of that is changing. And so again, it takes about 2.5 to 3 years for us to meet with each individual department for months on end, looking at how they work within their workflows today, and then trying to think about one, how can we reduce waste, not only to the staff, but also to the patients to make sure that we're more efficient, but then also thinking about the safety around performing those procedures, those workflows within that new environment. The best thing I can do is think about moving into a new house. And so while the physical structure is there, your toothbrush is in a different cabinet, your pantries are, in a different location, your refrigerator. So you're having to rethink about all of your day-to-day getting ready to get out of the house. And it's just like that, but for a nurse and a physician around doing the procedures and the medical support within the patient population.
Wow.
Mhm.
Wow. That, I mean, I think often people just assume, oh, well, we're just going to move and everybody knows your job and everybody's just going to figure it out. And that's not reality. Yeah.
Correct. We've gotten a few phone calls about a year out, and we have that, oh gosh, moment where we thought we could do it all in-house. We thought we had the support, but every person within that health system has a day job. And so we are typically bringing 5 to 7 consultants in on not quite a dedicated basis, but quite a few number of hours helping support the growth and the development of this. And so it's really important for people to realize that I'm not just saying this because I am a consultant and I love new work, but it's really important for your team to focus on their day jobs, the running of the hospitals, and allow us to support you, to elevate you, to make sure that you all are successful as you start thinking about how to operate within that new facility.
Well, that's really great and very eye-opening to me. As you think about location, what do you think is the biggest mistake that healthcare executives make in deciding on location or size or even like what will be housed in a facility?
Yeah, and I think that's a lot around our portfolio strategy work, excuse me. And so what we're seeing now, obviously the trends of mergers and acquisitions is that, large health systems are gobbling up some of these smaller mom and pop practices or these physician-owned practices. And sometimes they chose real estate based on the proximity to their house. And while that made sense in the time, right now it doesn't really align with developing your overall comprehensive portfolio strategy. And so we're looking at we've have some great health systems that are at a maturity level that they are willing to take a look at their entire portfolio, whether it's 100 sites, whether it's 1,000 sites, and say, help me make sense of this. Help me understand in my current environment, do I have the right facilities in the right locations based on different pieces of demographic information, claims data, market attractiveness. And so we partner with them and say, who is your patient population? Where are you going? What is your growth tactic around that? And then we leverage what we call Dimension Med, which is a location intelligence software that we help map out where their competitors are, where we see major growth within the market, where certain demographic elements are. And we really help them understand, do they have the right facilities in the right location? And if they do, then where should they go next? What does it look like in a future growth perspective? And how can we help you get there by making sure that you have a data-driven approach? So to answer your question, I guess more succinctly, is not having that data-specific approach, is really just thinking that you know the market, you know where it's going. But why don't you just do a little bit of validation too, to really ensure that you're looking at the whole and complete picture? Again, not only around market attractiveness, but I think capacity and utilization is also really important these days. We're finding that our real estate leaders are more engaged, I guess, recently and brought to the table more about, do we have the right size facilities based on what our growth efforts are? So the partnership between your real estate leadership and your strategic leadership is really important to make sure that you're bringing both ideas, both perspectives to the forefront. So then we are creating a right location, a right facility that supports the overall growth within your facility.
That's great. That's great. And that kind of makes me think a little bit too about with the emergence of AI and technologies and all the different tools designed and the goal to keep people healthy at home.
Yes.
What are trends that you are seeing around technology or different types of settings for care rather than the traditional hospital setting?
Sure. I think that there's a few different ways to look at it. I always say keep it simple. We have a lot of health systems that are going from 0 to 60 when they're building a new facility. Maybe things are even on paper. They don't even have, a great system-wide EMR, but now they're going to go through like developing that EMR, kiosks in the lobby. They're having other, nurse call systems, nurse locator systems, and they're really going 0 to 60. And while the intentionality is spot on and it is where it needs to go, we have to understand that not only the staff, but also the patients that you see every day, it's new to them. And so we need to think about really, I like to call a stair-step approach of what are some of those things that we can introduce early on, start that change process, and then how can we layer things on top for the years to come so we can bring everyone together and drive the technology advancements forward. And I worry a little bit about some of our clients that have, again, really taken things 0 to 60. And it's amazing they have the funding and the technology. But really, the impact to the patient, I think, is really important, and to the staff to make sure they're both comfortable within the environment. Now, having said that, I have seen some technology that has really helped a lot of our clients in rural environments or folks that just can't travel to a lot of different health systems around how you video in or telehealth in specialty providers around within your ambulatory environment. So we've seen our clients actually be able to bring in a specialist through that telehealth screen while they're with their primary care physician, while their family members are in the room, so they can have a dialogue around the appropriate care for that patient. And that patient is allowing a team member as well as their family member in the room. So everyone's hearing it together. And so, of course, there's a lot of security, some HIPAA. There's a lot of things that go into making sure that that works for that client and for that patient. But I've seen it done really well, and it's a huge patient satisfier to make sure that they are truly understanding the components around their care and making sure their family is with them within that conversation.
Mhm. Well, and as you talked about the, people, conferencing in for different types of meetings, and I'm thinking even about in the inpatient space as new facilities, whether that be an urgent care center or a surgery center or anything is created, should a lot of decisions about what is our 5 to 10 year strategy around virtual care be taken into account? Because if you're trying to retrofit like screens and monitors and all of that, that can be really challenging, can it?
Absolutely, yeah. So while I say it's a stair-step approach, the infrastructure needs to be thought about day one. So
Mhm.
we had a clients a few years ago that starting putting USB ports within their facility. And at the time, I was surprised. I was like, that's a lot of time and effort putting in all these USB ports in all of the inpatient rooms within lobbies. I mean, it was everywhere. And looking back, obviously that makes a lot of sense for where we are today. I think all of us are constantly connected to some sort of technology for personal use, and then also thinking about monitor upgrades and system upgrades. Now they have all these different access ports, and it's a lot less disruptive to that patient care environment.
Oh, that's so great. One of the things you mentioned earlier was talking about brand standard and then also thinking about how do we think about, I mean, we want our patients to be truly happy in the environment that has been created to feel welcomed. How do you see, this is not something I know a lot about, how do you, in your design or even your decor of a facility, how do you think about that from the standpoint of patient engagement, brand standard, um, creating a place where people want to come?
Yes. And so the one component around brand standards is to have patients feel like no matter which building of yours they walk in, whether it's an urgent care, whether it's your primary care doctor, whether it's the acute care setting, that it feels like your brand, that it is, you are already attracted to it, you recognize it, you know what your comforts, your sensory, you know what you're supposed to really feel within your environment. Because if you think about it, most people, when they're going into the healthcare environment, are for a negative reason, right? They're visiting a loved one, they're not feeling well, they're getting test results back. And so creating that brand consistency takes some of that anxiety away from that patient because they've seen it before, they've experienced before, and they that know there's ease of parking, there's ease of wayfinding, there's just some really comforting components around why brand standards and design standards are so important. I'll also say it goes around when you're trying to also figure out how you're going to grow. So if a provider is coming to you or an administrator is coming to you and saying, hey, I'm going to hire 5 GI doctors in the next 3 years, I need a new building. If you have design standards and planning standards and you understand your capacity and your utilization, you might be able to forego some costs of being able to forego a brand new building and say, hey, we actually have capacity in this facility. And it aligns with all our brand standards. It's been newly renovated. And so you create economies of scale by being able to understand the brand component as well as the capacity and utilization within your facility. We also will help alleviate the haves and the have-nots within every organization, right? That the squeaky wheel gets the something or other. That's
Yeah.
how we, you know what I'm talking about. That's how we feel like a lot within our healthcare systems. If there are people stomping their feet loud enough, they'll get that new building, they'll get that renovation. But by pooling all of this strategy and the real estate under one umbrella and looking at it and saying, okay, this is a request for a new space because of X, Y, or Z, it goes through this vetting process with a multidisciplinary committee that's looking at it. You're eliminating that have and have nots, and you're being more intentional about what you want to do within your portfolio, which again, not only aligns to your strategic growth, but I think it also aligns to making sure that your culture is one of inclusivity and making sure people are really aware of how they are prioritized and thought about within your organization.
Oh, I love that. So, I mean, really, real estate management, all the planning, all of that has to do with great patient care, but also really satisfied employees and associates who feel good about where they are, feel like they're being cared for in their environment, and making good decisions for the future. If you were going to share one thing that you wish every healthcare executive knew or thought about, what would that be?
I would honestly say communication. I know it sounds very fluffy, but I think there's a lot of really great ideas out there. And I think that a lot of great intentions. I do feel like sometimes we all get so bogged down with being tactical and getting things done and being results driven that we forget to take a step back and think about the trickle down impact and how to communicate to those folks that are in the front lines, whether it's at a reception desk, whether it's a parking attendant, whether it's a nurse that has aspirations to grow and be part of administration. There's so many different people and perspectives that I do feel like we forget to communicate very strategically and intentionally with our team members. Because as I started off this conversation, it's all around change, right? It's that is the underlying theme in what I do, and honestly, what I love is figuring out the impact of change and then understanding the appetite for change within that organization, and how do we create a healthy environment to accomplish both based on, again, those two components of the level of change, the appetite for change, and making sure that we're developing a clear, cohesive plan for our team, again, to make sure that they feel really comfortable within that plan.
I love that. I love that. Well, and we do some, well, we don't want to bother people with that, or when we get closer to time, we'll talk about that. And earlier is better, because if you're going to use someone's input, you need to have had the conversation before the decision is made, and to take into
Yes.
account perspectives before the decision is made. So
It's interesting you say that because we've seen some clients uh, not either have physician buy-in or clinical nursing buy-in, and we, keep asking to bring these folks to the table, and they'll say, no, it's an operational decision, or oh, it's an administrative decision. We'll clue them in when we need to, and it does. It always bites them in the butt because the moment those folks have a seat at the table, which they should have a seat at the table, transparency is so critical in the change process. Uh, they Something doesn't work, whether it's a patient safety issue, whether it's a perspective that someone didn't know something happened in that room, or there's many different reasons why there are challenges, I would say, within not bringing people to the table. I will always say, it hurts the worst the first time they hear it. So if you're building a new facility and maybe you're going into like a universal bed model, and it's going to impact how people work day to day, it's going to hurt the worst the first time, and you have 2 years to talk to them about it. So if you bite your tongue for 18 months and you telling them 6 months before go live, it doesn't hurt any less. So the more and more frequently you can tell them, the more you work them through that change process, the better it's going to be for everyone. It may not be easy conversation, it may not be enjoyable, but at least you know that you've done the hard thing to make sure that you are all working together to ensure, a safe environment.
That's great. That's great. What have I not asked you that I should have asked you?
Mm. Asking for help is okay. I know a lot of us, including myself, want to feel like you can do everything, that you know everything. And while that could be mostly true, I would say not a lot of people have opened a 400, 500, $600 million hospital in their current role, right? And so whether you just need advice and you need to phone a friend and engage someone on what are some lessons learned, what are some of the things to look at, all the way to I need to outsource the entire transition activation, all of those are totally appropriate, and it really just depends on you and your skill set. But don't just think that you can do it, because I've spent 15 years of my career moving hospitals. I think I've moved 80 to 90 hospitals, whether it's MOBs, acute care centers, cancer centers. And so there's a lot of things that I've seen. There's things I've done well. There's things we haven't done well. And so let us help you navigate your change within your organization. And I'm telling you, you'll learn something about it and you'll have a crutch to lean on along the way. So really, honestly, asking for help and knowing what you don't know, I think is so important in today's world.
No, I think that is really great advice, because even with it within my own organization, it's like no one can be a perfect expert on everything. I mean, no one can. And
Yes.
so it's not an indictment of your intellect or your ability, or even if you've done it in the past. Every site is a different site, likely in a different community, different people are involved. Having somebody to walk with you and to collaborate and be a sounding board and an advice giver, that's huge. So Stevie, thank you. It has been a pleasure talking with you. I learned a lot today, and I will continue to learn a lot as we continue our relationship. And I thank you again. I can't thank you enough.
Thank you so much, Cheryl. I really appreciated the time this morning.